Great. Thank you so much, Carmit. I'm going to share my screen, so give me just a moment. All right. Are you seeing slides? Okay, great.
Yes.
Okay, I'm going to get that off the screen. Okay, thank you so much for having me today. As Carmit said, with that wonderful welcome, my name is Kathryn Maguire Jack. I am going to be presenting to you a paper today that was published in the journal, the International Journal of Child Maltreatment, and it's called Neighborhood Poverty and Adverse Childhood Experiences Over the First 15 Years of Life. I do have 4 co-authors on this paper: Sarah Font, Rebecca Dillard, Daji Dashvili, and Sheila Barnhart. Okay, there we go. So this paper comes out of a couple bodies of literature that really have been interesting to me. So there's been a large body of literature examining the importance of what is referred to as adverse childhood experiences. They shorten it to be ACEs, adverse childhood experiences. And this comes out of a study from the late 1990s where they were interested in understanding the ways in which the experiences that we have as children affect our outcomes long out into the future. And so they had this questionnaire that was about different types of things that kids might experience, including 3 types of abuse: sexual, physical, and emotional abuse; 2 types of neglect, including physical and emotional neglect; and then 5 different types of family situations. So mother experiences of intimate partner violence, alcohol and other drug abuse, imprisonment or mental illness of a household member, and then parents who are separated or divorced. So those were the things that they considered to be ACEs. And they looked at how these things are related to different health outcomes that people experience. In the studies that have happened in the years that have followed, and there's been a large proliferation of literature, it has been found that ACEs are related to a number of negative health problems long out into adulthood, including things like cancer and heart disease. In addition to the stepwise relationship between the number of ACEs and negative health outcomes, there's also an important cut point, which is 4 or more ACEs. So they have found that people who have experienced 4 or more ACEs are significantly more likely to experience negative health outcomes. The second body of literature that interested me for this study was related to the importance of neighborhoods and the experiences that families have. So research suggests that above and beyond individual characteristics of families, neighborhoods have the potential to serve as a risk or protective factor for families. Neighborhood poverty in particular has been shown to be salient in child maltreatment. Prior research specifically related to ACEs has also suggested that there is a cross-sectional relationship between living in a neighborhood with high rates of poverty and a greater likelihood of experiencing ACEs. So for the current study, we were really interested in understanding whether that cross-sectional relationship that I just mentioned between neighborhood poverty and ACEs plays out over the longer term. So specifically, we examined whether neighborhood poverty at the time of a child's birth was related to their likelihood of experiencing ACEs over their first 15 years of life. So the specific research questions that we asked were, does neighborhood level poverty at the time of birth relate to the number of ACEs experienced at age 15? And secondly, does neighborhood level poverty at the time of birth relate to the likelihood that a child experiences that important tipping point of 4 or more ACEs by the age of 15? For this study, we used a US-based sample. It's a longitudinal cohort study of about 5,000 kids in 20 large urban US cities. It is called the Fragile Families and Child Wellbeing Study. They oversampled parents who were children who were born to unmarried parents, and they sampled them at the time of birth in the hospital. So there's 6 waves of data. They followed them at the time of the birth at age 1, 3, 5, 9, and 15. In terms of measures, our key independent variable was really trying to understand the neighborhood poverty level at the time of the focal child's birth. We used 3 different cut points of poverty, so less than 20%, between 20 and 39.9% poverty, and greater than 40% poverty. We picked those specific cut points because they've been identified by the US Department of housing and urban development as being a really important tipping point at which negative consequences start to happen for families. So we looked at those 3 different cut points, with under 20% being our comparison group. And then we looked at a number of different covariates, including the race of the child, maternal education, maternal age, sex of the child, economic hardship experiences, and the city that the interview happened. And our dependent variable was adverse childhood experiences. So within the Fragile Families data set, they didn't have a specific battery of ACE questions, but we were able to proxy ACEs through the very long survey questionnaire that they had. So we were able to look at parental divorce or separation, the death of a parent, imprisonment of a parent, parental mental health problems, parental substance use problems, physical abuse, neglect, emotional abuse, intimate partner violence, involvement with child protective services, foster care, and having an absent parent. We were not able to look at child sexual abuse because there was not a variable in the data set for that. In terms of the analyses that we conducted, we did 2 different types of models. As I mentioned, the first one, we were looking at the count of ACEs. So how many out of this number of different things did the child experience? In order to run those models, we used Poisson regression. Excuse my horrible French pronunciation, but we used the Poisson model that allows you to examine the count of ACEs as opposed to a linear regression, which requires a continuous variable. And then our second model was a logistic regression model, and that was to look at the 4 or more ACEs because it was a 0-1 outcome that you either have 4 or more ACEs or you don't. And then we had missing data, unfortunately, within the data set. As children get older, there are attrition issues, as you have with any data set. So we handled missing data using multiple imputation, using chained equations. So we used data within the data set, whatever was available for the people, to predict what they would have answered. So this is just our demographics table. As I mentioned, the Fragile Families sample purposely oversampled children who are born to unmarried parents residing in large urban cities in the United States. So as a result, the sample has a large proportion of economically disadvantaged families. You don't have to, I'm not going to go through every line on this table, but the important takeaway information from this table is that by the age of 15, the average number of ACEs experienced by children in the sample was 4.66. So that's really high because, as you recall, the 4 or more ACEs is considered to be a really critical tipping point at which negative health outcomes are much more likely to happen. So among this sample of nearly 5,000 kids, the average number of negative adverse childhood experiences that happened was 4.66. On top of that, over 2/3 of the sample, so 67.8% of kids had 4 or more ACEs. So that's a really high percentage of kids that are in that group that we're pretty concerned about being high risk. The other important thing to take away is the next line. If you look at neighborhood poverty rate, the average rate for the neighborhoods that at the time of the child's birth was 19.08. So that's a pretty high percentage of poverty happening across this sample. This table displays the results of our count models. So in these models, again, we use the Poisson regression to estimate the relationship between neighborhood poverty rate and the number of ACEs experienced. So as you can see in the table, living in a neighborhood with 20 to 39.9% poverty increases the likelihood or is associated with an increased likelihood of a greater number of ACEs experienced. And living in a neighborhood with more than 40% of residents in poverty is also associated with a greater likelihood of experiencing more ACEs. There's other interesting significant predictors here, including children who are Black, multiracial, or have parents who are experiencing economic hardship are all more likely to have experienced ACEs by the age of 15, whereas being some race other than white, Black, Hispanic, or multiracial was protective, as was having a mother with a high school education or more and having an older mother. This table is our logistic regression table. So this one is predicting kids who fall into that 4 or more ACEs group. And as you can see here, living in a neighborhood with a percent of poverty at 40% or higher was associated with a 51% increase of the odds of experiencing 4 or more ACEs. So that's a really high percentage. So you have a 51% higher odds of experiencing 4 or more ACEs if you live in a very high poverty neighborhood. Notably, the race factors are even have an even higher magnitude in this model. So children who are Black or multiracial have approximately 100% higher odds of experiencing 4 or more ACEs when compared to white children. So that was something we were interested in, and I'll talk about in a moment. Additionally, each additional economic hardship that parents experienced was associated with a 43% increase in the odds of experiencing 4 or more ACEs for a child. Maternal education and age were again protective in this model. So the implications of this work: children living in neighborhoods at the time of birth with higher levels of poverty have an increased odds of experiencing adverse childhood experiences, even after controlling for individual level economic hardships. So we can use these models to predict, based on where a child is born at the time of birth, what their experiences will be like over the first 15 years of life. The policy implications include reducing poverty and investing in under-resourced neighborhoods. I mentioned in the previous slide that we saw these huge racial disparities within our sample. So there was a high level of racial disparities in the findings. We did conduct some sensitivity analyses that I didn't have time to talk about today, but we were essentially trying to understand whether it was systems involvement driving those racial disparities, because we included things like parental imprisonment, foster care, and involvement with child protective services. And so we were curious because in the United States, we have a large problem with racial disproportionality within those systems, with African Americans being highly overrepresented in all 3 of those systems. And so we wanted to know if that was driving the differential findings. We found that there were additional disparities above those institutional level involvement type variables. We definitely saw the disparities there, but it wasn't driving the relationship. So because ACEs can be predicted to some extent by the neighborhood residents at the time of birth, investing in communities beyond investing in just programs or services for individuals could be fruitful. The disparities, again, go beyond those institutional involvement type variables and are consistent with a broader understanding that net of poverty, Black families in the United States face additional socially imposed stressors and hardships that contribute to higher rates of ACEs. Some of the ACEs, like higher rates of parental separation and divorce, mental health, and harsh parenting, might be explained by higher levels of stress, both due to present-day discrimination and the lack of efforts to mitigate the effects of historical discrimination, like residential segregation. So finally, I just want to mention that there are definitely limitations to this study. So this sample was limited to large urban cities. We really don't know the extent to which any of the findings would translate to a more suburban or rural context. It was all done within the United States, and we definitely have some interesting and unfortunate historical situations within the United States that could be contributing to some of these findings. Additionally, we had self-report measures on all of the ACEs, so things like maltreatment, intimate partner violence, mental health issues, substance use issues, systems involvement. All of those things are attached to stigma and shame in the United States and probably elsewhere, but are definitely subject to social desirability bias, with people perhaps not admitting the true level of these things going on within their family.